there was this burning desire. If you could make a difference in the life of that single person, why not stretch it further? And someday I just sat and the inspiration came to write down the aims and objectives. And I used an old diary, wrote it down. The diary is still there in the archives today.
Years ago, one man's compassion sparked a movement that has changed thousands of lives across Nigeria. In 2015, our founder and executive director, Mr. Pascal Achunine, an Ashoka Fellow, saw a heartbreaking reality: indigent patients in hospitals unable to pay medical bills as low as 20,000 naira. From that burden, Health Emergency Initiative HEI was born with one mission: that none should die.
Looking at those individuals who are making a difference. Now, we are joined by Pascal Achunine. He is a philanthropist involved in various charity programs, including empowerment of widows and feeding of children in slums. I'm going to start with you, Pascal. I know you are committing up to 20,000 naira per patient in emergency cases in hospitals. Tell us a little bit about some of the work you're doing.
We are glad to feature on the day you're on the topic, taking the topic, making a difference. Yes. The philosophy behind the Birth of Health Emergency Initiative is an organization that stands in the gap for the poorest segment of the society.
Through our medical intervention program, we have supported over 35,700 indigent patients, giving them a second chance at life, proving that a little help can make all the difference.
So I really appreciate them. They tried a lot. God will continue to bless them.
I just want to say thank you to HEI people for their support, for everything they did for me and my son.
But our journey didn't stop there. We saw countless road traffic accident victims losing their lives before receiving care because hospitals oftentimes require deposits first, and this applies to both the rich and the poor. So we stepped in, becoming the next of kin to the helpless. Through our post-crash care program, HEI has assisted more than 50,000 individuals in emergencies, including 6,780 critically injured accident victims. Still, many never made it to the hospitals because no one around knew what to do in those critical first minutes, the golden hours. So we began to equip everyday people with life-saving skills. Our first responders training program empowers students, teachers, FRSC officers, LASTMA, police, NYSC members, artisans, CHEWs, and community members with CPR and pre-hospital emergency response skills. Today, over 147,500 first responders stand ready to save lives, ordinary heroes trained by HEI. In addition, HEI has issued several admission packs to health facilities handling emergency cases, ensuring they are better equipped to respond swiftly when lives hang in the balance. And when we saw that malnutrition contributes to 45% of child death in Nigeria, we acted again. Through our community-based intervention against malnutrition, CBIAM, over 8,000 malnutritioned children have been enrolled and nourished with ready-to-use therapeutic food and vital nutrients. During the COVID-19 pandemic, when fear and scarcity filled hospitals, HEI provided PPE worth over 79 million naira to hospitals and health workers, standing by those who stand for life. Over the past decade, we've partnered with more than 100 corporate entities and individuals, reaching over 89 health facilities across 16 states in Nigeria. Our story is one of love, empathy, compassion, and genuine action. 10 years on, our message remains the same: that none should die. Together, we have saved lives. Together, we will save more. This is only the beginning. HEI, that none should die.